It's Dr. Mora. I just want to show you what a root tear looks like on an MRI. Hopefully this will help you identify these tears, which are often missed even by experienced radiologists. It starts out by knowing the history. If you see a 50-year-old, approximately 50-year-old patient, maybe a little overweight sometimes, misstep, posterior knee pain, severe swelling, painful weight-bearing, suspect a root tear, especially when they say it hurts in the back of the knee. So number one, pain in the back of the knee. X-rays usually show a little bit of joint narrowing. So for example, this particular patient, 50-year-old male, slight medial joint space narrowing, not much at all. And then you do an MRI. You should do an MRI, especially when they have a lot of swelling. And this is what you see. You see bone marrow edema, medial tibial condyle. Bone marrow edema, medial tibial condyle. Start to think root tear. Extrusion of the medial meniscus. See how it's more medial than the edge of the medial femoral condyle. Start thinking a root tear. Then you scroll to the back. You got to go to the back and you will see a gap. This is a gap right here, this space right here, right between end of the meniscus and the root attachment on the bone. So go to the back, look for the gap. So once again, to summarize, bone marrow edema, extruded medial meniscus. Go to the back, look for the gap. It's also not unusual to have a little bit of a cleavage component like this of the meniscus. Sometimes you even see bone marrow edema posteriorly. Now, when you go to the sagittal image of the MRI, here we're going to start medially. Actually, let's start laterally, where we will then look at the normal structures. Lateral meniscus, fibula, head medially. Okay, there's the Risberg's ligament right there, the lateral meniscus. Posterior or PCL is right there. As soon as you see the PCL, then you take one click and you should see medial meniscus. You should see medial meniscus here, but you don't. And that's called a phantom meniscus sign or disappearing meniscus sign or ghost meniscus sign. There's a meniscus, medial meniscus, and you see where the red line is. We're actually over here in the mid zone of the posterior horn, but I'm going to move this way. And then this is the area where the meniscus is actually not present, and that's why it's called the ghost sign. The space right here, or the gap, is what makes it look like the meniscus disappears. So let me back it up so you can see where we are. Now watch the red line over here and watch the sagittal images over here. See, I'm heading towards the gap. You can still see meniscus. We are now in the gap and there's no meniscus. And that's why it's important to be able to look for that on the sagittal images. PCL, once again, go medial. We're in the gap, there's no meniscus. So disappearing meniscus sign, and then all of a sudden the meniscus pops back up. That is solid finding for root tear of the medial meniscus. And once again, there is bone marrow edema. Now there are some other pathologies in this MRI. For example, a little subchondral edema over here of the patella, but the patient did not have patellofemoral joint symptoms. Once again, 50-year-old gentleman, misstep, posterior knee pain, swelling, and a weight-bearing related pain that slowly gets better but is not quite right. Root tear of the medial meniscus. And if we look at a model, what is it that we're actually looking at? It's going to be kind of hard for me to show you, but this is the patella, medial meniscus. Let's go all the way around. Let's take it around to the back of the knee. And I kind of marked off where the meniscus tear is at. When it's a root tear, it's almost there. But you see how the PCL is right there? And right next to the PCL is the root. And when there's a tear, there's a gap. Okay, there's a gap, just like I drew right there. And that's what we see when, or that's what we look for on the MRI. Once again, Dr. Mora showing you Mora cutting edge orthopedic surgery here at Restore, and I'm showing you how to read an MRI when the story is suspicious for a root tear of the medial meniscus. And by the way, these tears are important to identify because in most cases they need to have surgery to reestablish the meniscus integrity and function so that the likelihood of arthritis is less. Because as you can see, the bone marrow edema is from excessive pressure of the femur on the tibia, causing trabecular bone failure right there. Hopefully that's helpful. Please reach out to me when you're ready for an evaluation or consultation. Take care, Dr. Mora. Over and out.